Healing Our Village presents
COVID Conversations.
Where does she get her information from? Do you watch TV with her?
All of these things that we
Learn
find
about
in
staying
African Americans increase your susceptibility to getting the virus, especially this more contagious
Determine
Delta
the facts.
Right now, in hospitals throughout the country, but most certainly in
Hear
the
from
South.
the community.
What happens if it's positive? So you do not want to take the risk.
You need to ask those questions.
What made you come?
Because I want to get vaccinated so me and my family won't have COVID.
Hi, this is Dr. Lenore Coleman coming to you today on For Your Health. As you know, I'm the president and founder of Total Lifestyle Change and Healing Our Village. And for the last 6 months, we've been doing COVID conversations. Today we have with us one of the people that was actually on the show early on. This is the amazing Dr. Kevin Sneed. He is the dean at the USF College of Pharmacy. I've known Kevin. He's a colleague and friend of mine for years. He knows not only microbiology, but immunology, and he's a working and practicing pharmacist. So I want you all to know that this is someone that you're not hearing from out here in our marketplace. So he's going to give us just a little bit of his time today, and he has said he'll come back because still got a lot more to cover on this show. But Dr. Sneed, Kevin, I'm so happy you're here today. Thank you so much for coming.
Thank you very much. I'm very happy to be here with you. And again, congratulations, for the wonderful work that you continue to do in the community.
Oh, my goodness. And listen, you said something when I talked to you last week that you have done 131 presentations on COVID, which is just, I think you may have the record. I don't think anybody has done as many presentations as you have. And so you have a unique perspective because you're talking to the community. You're actually going into churches and community centers and doing things on television and radio. So I want to get your perspective. Where are we right now, as far as you feel, with COVID-19 and what we need to think? What's the most important thing you want to tell our audience today?
I think there's several things that we probably really need to make everybody aware of. Number one, we've known for many months now, and before I make this comment, part of the scientific team I have here at the University of South Florida within USF Health. We have people that do predictive modeling, very similar to the hurricane predictive modeling. They use very similar equations. So we've known for a long time now that we are probably on the back end on the national level of the Omicron wave that has hit. I fully anticipate that probably by the beginning of March, that we should really have it in our rearview mirror. And that's a very key thing to understand because I think a lot of people are going to try and take a lot of credit for Omicron, magically going away. But we've known probably since early December, according to our predictive modeling, that we were going to be exactly where we are right now.
Exactly.
That's number one. Number two, the other thing I would really like for our viewers to really kind of take to heart, many people, when I talk with the community, many people are wondering, when is it going to be over? And why do they keep changing their mind? Why can't the CDC or the FDA or Dr. Fauci and all these different people that keep telling us something different? The story keeps on changing. And so I have to remind people of two very important facts. Number one, not one variant that has emerged in our country, the United States of America, of the dangerous variants, and let me be very clear about that, none of them originated in our country. They have always originated outside of our country and then migrated around the world and then have come into our country. And they have typically, especially when it comes to Alpha, when it comes to Delta, and now Omicron, they have typically exploited the fact that we were not vaccinated. So we have to stop pointing the finger at different people and changing messaging, because every time a new variant came along, that variant had a little bit different characteristic than the one before it. And we have to adjust to the virus. So we are not changing. The virus has changed, and we're having to adapt to what that virus is telling us it will do to us, number one. And then number two, and probably just as important, the vaccines that we have on the market right now have remained active against the variants. Now, they remain active in varying different ways, but the story has remained the same, that if you are vaccinated, and with the case of Omicron, if you were vaccinated and boosted, you had a great deal more protection than if you were unvaccinated. And for people running around saying that their immune system is very strong and they believe in natural immunity, I'm going to pause right here and let you ask me the next question, because this may surprise you, but the evolution of the coronavirus really it has a skill set to be able to evade, and even in some ways, my lay term for it is almost deactivate the early portion of your immune system, to the point where the first 5 to 7 days, your body doesn't even know it's been infected.
Wow, wow. And during
And
that first 5 to 7 days is when you are most likely to spread. See, a lot of people don't even get the symptoms. They don't understand that that thing's been in there replicating and growing in terms of the load of the virus. And then during that sort of period of time is when you are most infectious. And some people have never got symptoms. So that's the thing that I don't think people understand. But you would actually said something about there may be some ideas that when that virus, the Omicron came here, it had been here for a while. And it had just been incubating and changing and learning the systems. I thought that was really interesting.
well, let me clarify that comment just a little bit more. Again, if you go back and take a look and I'm going to focus on 5 variants just for a quick moment, but I'm going to skip over Omicron, so I'm going to talk about 4. There was a Gamma variant that originated in Brazil, or we first found it in Brazil. We had the Alpha variant that we first found in the United Kingdom in England. We had the Beta variant, which originated in South Africa, and then the Delta variant, which originated in India. So when we take a look at how those emerge from all the genetics, we can do what I call ancestry.com, Dr. Coleman. For every variant, we can actually take the genetic lineage, it's called a phylogeny tree, and we can go back and we can understand exactly where it emerged. We can actually tell what animals or what people it may have been in, to be perfectly honest. And so all of those variants I just mentioned, they all emerged in the year 2020.
Okay.
Okay. It's really important to understand that. Now Delta emerged in October of 2020, and by the time it got to America, it was kind of summer of 21, and it ravaged everything. When we take a look at that very same genetic lineage for the Omicron variant, it emerged from way back way back almost from the beginning, from an earlier variant, and it's been hiding out somewhere for a very, very, very long time. So that leads us to believe that and my hypothesis, and this is shared by many scientists internationally, my hypothesis is that before it became Omicron, that coronavirus likely infected an immunocompromised individual. For context, it could have been somebody with HIV that had, not AIDS, but HIV, where they had a compromised immune system. And this virus continued to replicate over and over and over and over again in this body, because that individual's immune system did not have the capability of stopping it. But these cycles is what we call it. Every time it did that, it learned the human body a little bit better.
Yeah.
Okay. It learned how to exist, and it found the avenues and the secret portals of our cells in our body. And then by the time it was transmitted to somebody else, we had an Omicron variant that had 30 mutations on that little spike protein, that it became the most infectious form because it had learned how to evade our immune systems even better, and it learned to replicate faster and more efficiently than anything we had before. And so you're right. The Omicron variant was probably existing. I mean, as we blame South Africa, but I think looking back, it was already around the world. It was probably already here in America at a fairly low rate before we even detected it in South Africa. So if we don't vaccinate the rest of the world, if we don't find a way to shut down the variants from developing around the world, we are going to continue to be subject to new variants emerging from outside of our country, but then coming into our country and continuing to ravage us and reinfect us at pretty high rates.
Right. So when you're talking to your folks out there, because I'm in Georgia, I'd say I have about maybe 30% of people here that I can't move. I can't move them to take a vaccination. They have all sorts of reasons why. Some of them they can't even articulate why. I say, why won't you take the vaccine? They say, I don't know. I'm just gonna wait and just see. And I keep trying to explain to them that that is not a good idea because of long COVID. And I want to make sure we get that in right now. So talk to us about, rolling the dice and just hoping that, I had COVID last year and I'm okay. And so I'm not going to take the vaccine for that reason.
Yeah, well, let me take the second part of that first. For people who say, I got infected and now I'm good forever. Well, if you got infected, you've been good for probably a 3 or 4 month period. Okay, and that's proven. We have proven that fact. Your antibodies are going to wane after that time period, just like anything else. And now we'll come back to T cell and B cell immunity and all that later. However, what many people, and Lenore, as I'm answering the question, do many of the people you talk to, do they still feel like this is a respiratory virus, just like the flu? Are you hearing that?
It's just like the flu.
Okay, so let me talk to all of your viewers very quickly and let me dispel that. This is not what I call a respiratory virus. This is a cardiovascular virus. The cells that it winds up infecting in the body are part of our cardiovascular system. So Lenore, you and I are pharmacists. When we talk to people about ACE inhibitors, okay, or when we talk to people about angiotensin receptor blockers for blood pressure control, this virus attaches onto what is called the ACE2 receptor, which is a part of the overall system, the angiotensin system in our body. And that's what it attaches onto. And by the way, that ACE2 receptor is in virtually every organ from underneath your collarbones into the pelvis of your body, and virtually every organ in between. So this is a cardiovascular virus. And so for people that have diabetes, for people that have high blood pressure, if you fall into the overweight or obese category, and it's attaching on, it can now rev up these inflammatory proteins that wind up causing damage to the actual physical organs that it has overrun. Gotcha. So many people don't know, and that's why the Delta variant, to be honest, as many people as we still have dying from Omicron, many people are not aware. We have the equivalent of like 10 plane crashes dying from this virus every day.
Every day.
Or more.
Every day.
Yeah, or more. So, I was talking to someone in the community and they said, well, I'm going to take my chance. And I said, well, how comfortable would you feel if you were going to get on an airplane and you knew that 10 airplanes were crashing around the country every single day? Would you feel comfortable getting on an airplane if you knew that 70 airplanes were crashing in a week? And she said, well, no, I wouldn't feel comfortable. And I said, well, that's why I feel uncomfortable with, you taking your chances on say, I'm going to take my chance and get infected because, 2,500 people a day are still dying in this country.
Yeah.
But this cardiovascular nature of the virus is one that many people are not aware of. The Delta variant has still proven to be the most deadly variant we've encountered,
Yes,
I believe.
yes, yes.
And many people out there don't know that most people were dying of multi-organ failure.
Yes.
So let me, so again, the Delta variant in particular, but the coronavirus overall, it can cause damage to your heart. Okay, I'm talking physical damage with myocarditis. It can cause damage to your kidneys, kidney injury, kidney damage, kidney failure. It can cause damage to your liver. It can cause blood clots in your blood vessels. And now we're finding, Lenore, and this is going to hurt you more than anybody else I know because of your deep community passion around diabetes. There are ACE2 receptors on the pancreas, so now we're finding that it can probably damage the pancreas, which will lead to, all of this can lead to long COVID, meaning even after you get over the initial symptoms, there are still an avalanche of different things that can actually occur with people in terms of problems breathing, problems with their heart, neurological problems. I mean, there's so many different things that we're finding, and we don't have a cure for it.
No.
There is no cure.
No, there is no cure. And there are some treatments that have emerged and they're coming out, not in widespread distribution. Don't know how much those are going to cost. And right now, which is like an amazing thing, people give our current administration a hard time, but this is the first time in my lifetime, and I'm 68 years old, I have never seen to the extent that this government is buying masks for people, testing for people, giving vaccinations for free to people, allow the monoclonal antibodies to be given infusions for free. I mean, this is unheard of. Who does this? That people don't understand that those drugs are expensive. We need to tamp this thing down because we don't have an unlimited pocketbook here, folks. At some point, the government's not going to be able to keep up with this.
Well, you're bringing up a great point because, again, the worst, if you get vaccinated, you're preventing the virus from attaching onto all of these internal organs at the rate that it would have if you were not vaccinated.
Right.
And so if it winds up damaging the physical organ, we don't have a way to, at this current moment, repair that. We're going to, everything that comes after that, we're going to try to try to mitigate the damage that's been done.
Right.
So vaccination is very important. That's number one. So we're going to wake up one day, and these medications are thousands of dollars per treatment.
Thousands of dollars per treatment.
Okay. When the vaccine is literally $20 a shot, will protect you longer. It will activate your longer immune response, meaning your T cell and B cell memory, so that if you encounter it again, your body can rev up the antibodies more quickly and protect you. But we're going to wake up one day, and I think a lot of unvaccinated people are going to find themselves in a world of hurt because the federal government will not continue to subsidize all of the treatment that is happening right now from insurance companies or from hospitals. And so I'm fearful that much of that cost is going to shift over to the individual. So if you wind up in the hospital and you have to go into the ICU, and they're no longer able to recoup that reimbursement for you having been there from the federal government, eventually they're probably going to turn around and try and recoup it from you.
Yeah, they are. There they are. And so, when you talk about pre-existing conditions, see, we got to the government, with Affordable Care Act, they got that in there, but a pre-existing condition is not going to be covered when there is a $20 vaccine that you could have taken and you choose not to take it. That's different than I wake up one day and I got cancer, or I wake up one day and I got diabetes. But there is something that can prevent you from having these end organ situations that you're talking about due to long COVID. I just wanted to, there's so many questions, and thank you so much for coming back because we can't cover everything. What are the other things? You're down in Florida. If you have to sum up the one thing that is you want to dispel today that is just incorrect in terms of these folks not wanting to get vaccinated, what have you heard most?
Well, I'll tell you what. The thing I've heard the most is that the vaccines were they don't trust them because they were originated too quickly. We studied them too quickly. We don't know the long term outcome of the vaccines. Well, let me dispel that very quickly. First of all, the platform, what we call the platform, the mRNA platform. We've been studying this mRNA technology for 25 years. We've been injecting people with mRNA vaccines in clinical trials for 25 years. Most of it actually originated in cancer research for 25 years. And so when the current pandemic hit, we had the solution sitting there because we had been working on it for 25 years. And so, no, we didn't wake up and it didn't originate too quickly. We didn't take one shortcut. We have never had more people in clinical trials around a medication technology than we had for these vaccines. I'm
Yeah.
talking 30s, 40s, 44,000, 50,000. There's about 200,000 people in these clinical trials overall. We've never done that quickly.
Yeah.
And so we have to stop people from thinking, I don't trust it. We don't know what it's going to do to you long term. Is it going to cause infertility? None of that is true.
None of that is true.
We dispelled all of that lack of truth. But you know what is true? You go back and look at the data, and overwhelmingly, if you are unvaccinated, you have anywhere from a 23 times greater chance of dying than if you were vaccinated. You have, a 13-fold greater chance of just getting infected and having a complication than if you were vaccinated. Thousands and thousands of women all across the country, many of which I know personally right now,
Yeah.
have been vaccinated and they had healthy children. Nothing is happening there. All of everything that people keep falsely telling the narrative that the vaccine is harmful has not panned out
No,
at
it hasn't.
all.
So now, real quick, before we wrap for this session, mask or no mask, a few of the states now are getting rid of their mandatory mask requirements. Where are you on that whole thing? And not only for adults, but also address masking for children.
Yeah, so I remain a proponent of wearing masks when it's appropriate when you're indoors. Now, if you're outdoors, I say take the mask off. But the reason, by the way, remember I talked about every variant being different? Let me give you some quick numbers that will startle you, and we can pick this conversation up the next time. From the original version of the virus that came out and here in like February of 2020, the Alpha variant replicated 100 times more than the original version in our body. The Delta variant replicated 1,000 times more than the original version in our body. And the Omicron variant is somewhere between 70 and 100 times more than the Delta variant. So now we're talking about, when we're telling people we want you to shift to a N95 mask, it's because your body is replicating so rapidly and can spread so easily that we have to have a better mask to shut down you from giving it to other people and to create the best opportunity for you to not inhale it. And so I think we're doing away with, I think we've gotten too comfortable too quickly. The infection rates are still hovering at 17, 15, 17%. They need to get down below 5%.
Yeah.
But we need to give people hope. I do agree. We need to give people hope that when the infection rates do drop, and they're going to drop and plummet rapidly, that we can do away with the mask at that time.
At that time.
And I think, and let me just tell you one quick story because I know we're right at that time that we have to shut down. But let me tell you about children. Children have been hospitalized at a rate higher than at any other time during the pandemic. That hospitalization rate happened much higher, and they were much sicker during the Delta wave. But we have a lot of children that are bringing the virus home to their parents and grandparents. And I have encountered, and I'm going to be very careful not to to identify anything, but a child that brought it home to a parent, infected the parent, The parent got sick and died. Now, this story is replicated all across the country dozens of times.
Dozens of
And so
times.
so if you can't get vaccinated for yourself, get vaccinated for the people around you, because I can't tell you the number of children now who have been orphaned. I can't tell you the number of parents, and I'm going to talk to the fathers out there. If you are a father of young children, I know I've read stories and I know of cases where a father died that had two young girls. What that individual did is now leave the responsibility of walking those two ladies down the aisle when they get married
Yeah.
to somebody else over something that could have been prevented. We need you to walk your children down the aisle. We need you to become a grandparent to your grandchildren.
Right.
And so this virus, it doesn't care about politics. It doesn't care about race and ethnicity. It doesn't care about socioeconomic status. It will infect any and everybody. And so you owe it to yourself to try and live. And that's the overwhelming message I give to our community. And by the metrics, we're showing that it has been effective here in the Tampa Bay area. But again, we're going to have to continue to work harder to get the message out, Dr. Coleman.
Yeah. So I need people to get tested, because then at least you know if you got the virus, right? So that's like, thinking you're pregnant and not getting tested. That's like you think you got gonorrhea or syphilis and you just go and say, oh, well, I don't need to know. Okay, but you do need to know. So what you do, you go get tested. So you don't wait till you get sick necessarily to get tested, but you just need to routinely just make sure that you're clean and safe, so you are not infecting your family. Because if you're not here, who is going to take care of your mom and your dad, your elderly parents? If you're not here, who's going to take care of your children? And you don't know how many of those stories are of these children being orphaned. That means they're going into the foster care system. Sometimes the families aren't in a position to take care of them.
Yeah, I mean, it's been pretty tragic overall.
It's tragic.
And again, I understand when the public, when we don't understand, we have fear. But I fear the virus far more.
Yes.
Oh, let me give you one more stat. For males, for men between the age of 20 and less than 50 who are unvaccinated, 1 out of 5, 20% of them are developing forms of erectile dysfunction, because the virus can actually attach on and damage the male reproductive organs.
Wow.
So we have to. So again, these stories, and you can go online and whatever search engine you like to use, you can find the validation of the research that's been done in these areas. Some of it was done down at University of Miami, right here in Florida. And so we're encouraging people, get vaccinated, protect yourself.
Yes.
Please protect yourself. We want you to live a full life. We can argue later.
Yeah.
But let's live today.
Let's live today. I'm going to let you go. I know you have an appointment to get to. I want to thank you so much. I just appreciate all that you do. And we're going to get you back in the next few weeks so we can continue this conversation, because you're down there in the hotbed of activity down there in Florida. I'm here in Georgia. We're only at 45% fully vaccinated in the state of Georgia in 2022. 45%. And the African American community is lower than that.
Yeah, let me share with you, what I fully expect to happen. I'm not trying to raise your blood pressure, Dr. Coleman, so just bear with me for a moment. And this will be my last comment, and I do have to go.
Yes.
What I fully expect to happen when we get beyond the Omicron wave, I think that will be it for a period of time.
Okay.
I think we're all going to have a good summer. The Omicron wave has burned through everybody it's going to infect in this country.
Right.
Okay. We're probably going to have a good summer, but all indicators right now are, if we don't do better surveillance around the world, and if Mother Nature holds up to what Mother Nature has done, probably later on this year in the fall, there will be another variant that could emerge, and it may be just as dangerous or more dangerous than Delta. There's nothing indicating that it won't be.
Yeah.
So don't believe the false narrative that, a weaker version of, it will continue to weaken and become more mild. there's no reason for that to happen because, to be honest, there was no reason for the COVID-19 virus, SARS-CoV-2, to emerge and take over the world the way it did.
Exactly.
Imagine if we had started off with the Delta variant around the world, and that was the original with no vaccine.
No vaccine.
These are the stories that we have to continue to tell our public and try to get them to better understand what's happening. That this cardiovascular damaging virus, and we have a solution. We have a solution. So we need to do everything we can to protect ourselves. And so, Dr. Coleman, I just want to thank Healing Our Village. I want to congratulate you again on all the great work you're doing. I look forward to continuing this conversation a little bit later, and I'm just thankful for you to have your friendship.
Thank you.
I was sharing with my wife how long we've known each other, and it's been a great journey. It's been a great journey to be a friend with you for a long time.
More work to do. We have more work to do.
More. Yes, we do.
All right, thank you, and for coming in today. And we're going to stop here for your health. But listen, here at Healing Our Village, 800-788-0941. That's how you reach us. We're doing testing here in Jonesboro, Georgia, 2 locations. I can get you vaccinated. I know where to send you. And we're still doing our diabetes and hypertension. Go to my websites. That's HOV Health.com. Everything you want to know about COVID is on that website, as well as TLC Global, DLC-global.org. So again, thanks so much, Dr. Sneed. I appreciate you, and we'll be back talking to you in a week or so. Thanks so much.
Remain safe and blessed, my friend.
Yo, you too. Please stay safe.
Epigallocatechin gallate, superoxide dismutase, glutathione peroxidase. Now, those are names you probably aren't familiar with, but you should be. Those are antioxidants known to fight free radicals. In fact, did you know that some viruses are actually alcohol resistant? One major study showed that by adding the epigallocatechins from green tea, it killed the virus on contact. Please allow me to introduce myself. My name is Mark Johnson. I'm here to share with you an exciting new, technologically advanced, patent-pending green tea hand sanitizing wash from Handout Protection. Now, this is not your typical hand gel designed to just smear all over your hand. This is a hand washing sanitizer to cover your entire hand, both the front and back of your hand, in between your fingers and your wrist. This is a non-sticky sanitizing hand wash designed for convenience to take with you in your purse, pocket, or carry in your lunchbox. As Dr. Josh Ridge has stated, what goes on your body goes into your body. That is why we choose only the highest FDA-compliant ingredients, such as 75% isopropyl alcohol in organic green tea brewed with alkaline water. The only way to protect yourself and your family is to always carry a disposable package of Handout with you. This may be the only handout you ever need.